The world as we see it is a product of ideas that were once thought to be crap. As the earth revolves around the sun and rotates around itself, so are human minds. This is where icons, heroes, pioneers, talented and committed ones shine their lights. Little by little, led to what we now call science, medicine, physics, driven by curiosity, necessity, challenge, or fame. Necessity is a mother of invention. There is systematic scientific research, there's chance, there's revelations, dreams, but invention after invention led to human civilization, technology, and that meant the science was advanced and evolved. He joined the scene, and he is depicted in the chloroform and the Science of Medicine, The Life of John Snow. Dr. John Snow was a bright, energetic, eager to learn, motivated, and a caring human of the 19th century. From introduction to the conclusion, in the book we sense how Snow was an anesthesiologist, epidemiologist, a medical doctor, a thinker, a theorist, social worker, counselor, and medical cartographer. He was an extraordinary man, an elder son of a Yorkshire farmer. He never married until he died in 1858. He was a doctor with genius capabilities of observation, addressed the General Assembly on his findings on cholera and water supplies. He started medical school at 14 years and became a surgeon at 25 years after 11 years of experience. Dr. Snow continued to desire specializing in controversial anesthesiology. His contribution to medicine and epidemiology were recognized posthumously. He used his clients as case studies and made theories out of his own job research and practices. As a public health officer, he attended medical society meetings and continued to study the cholera epidemics of the 1849 and 1854. He removed the handle from the Broad Street pan, and that made him a central icon in the history of public health. He was a lone genius researcher. He discovered causes of cholera, medical mapping, and modern epidemiology. As a doctor, he used ether, chloroform on medical scientific principles. With visiting patients throughout London, he applied scientific perspective to the new epidemic of his time, cholera. As a researcher, he thought that disease had underlying patterns of normal functions. The first respiration of newborns, he thought that was foremost a chemistry of exchange of gases. And he identified some causes of asphyxiation. He supported his discoveries by papers of other people, for example, Lavoisier and so on. Theoretical research interest stimulated by practical problems. Scientific evidence translating into medical practice based on physiological principles. He was working in his home laboratory. He managed problems in scientific manner with respiration, where he thought respiration was essential to the whole animal kingdom. So reestablishing it was a central and appropriate measure. Direct and indirect method, artificial respiration, handheld resuscitations, practical solution to medical problems by applying the physiological principles. He had many dilemmas. He thought it was difficult to remove from the people's mind the habitual practices in favor of new and evidence-based practices. He thought it took time and more lives. Many practices were at odds with conventions. After he's gone, Snow, who died of renal problem, hypertension, and stroke, is remembered for his Broad Street Plump campaign, cholera epidemics in 1834 and 1854 in Soho. A bar near the pipe changed the name to John Snow, and he was recognized from the US rather than London. John Snow Society celebrates his teetotal heroism. Long after he's gone, his tomb memorial was destroyed in 1941 by enemies and was restored in 1951 by the Association of Anesthetists of Great Britain. His reputation was reinvigorated in England, and he is known as a pioneer in epidemiology and anesthesia and other disciplines as well. 1.5 centuries after his untimely death, Snow arises from the hardscrabble doctor to pioneer in inhalation anesthesia. Principles set by Snow guide inhalation anesthesia to the present day. Epidemiological and public health and sanitation legacies. Snow theories of causes of cholera are recognized, and the American Public Health and the Royal College of Anesthesists institution were named after him. One of them is in Boston. Too many legacies for Snow. One of them is epidemiologist, anesthesiologist, medical doctor, a cartographer. He visited patients in their homes, administered medicine, attended to the Queen Victoria twice during labor. Snow drew conclusions with limited resources. The information that was available. This book that was written by Peter Vinton Johnson and Howard Brody and others in 2003 is an interdisciplinary and synthesized account of John Snow. This book is talking about life. However, it describes the professional rising of John Snow. Clearly states the author's view of Snow and measures his actual contribution to all fields he was interested in. This book shows Snow as an original thinker, depicts him as a talented and committed scientist. Snow did not stay in hospitals or clinics to wait for patients. He reasoned health and well-being were multifactorial, visited patients or people in their home, and gave health education. He longed for improvement in his practice like modern medicine. In this book, I can also see that they were clear about how Snow was not welcome everywhere, and rivalry or rivalry was existed between health professionals and syndicates. And Snow was comparatively unnoticed and unknown, and he struggled at the beginning of his demanding career. Controversies over chloroform safety, lucid rebuters could have come against Snow had he been alive today. As a conclusion, I thought this book was a descriptive account of both professional and family life of John Snow. And John Snow was a selfless and committed to the wellness of others. I was fascinated by the capability to focus on both curative and preventive medicine. Clear depiction of a hero in both medicine, epidemiology, anesthesiology, social and community development work, and a tireless health advocate. Thank you very much.